Let's Achieve Change is a podcast by Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. I propose to be that advocacy channel, making you aware, bringing the public more information on health and wellness topics, especially as it pertains to chronic pain and disabilities. I would like to be that voice for those silent sufferers out there who are not able to speak for themselves. If you'd like to know more about Let's Achieve Change, please visit our website at changeachieve.com or pamelagrove.com. If you'd like to be a speaker or you know someone else who wants to be a speaker, also visit the website and leave your email information and we will be in touch with you as soon as possible. Let's Achieve Change will air every 2 to 3 weeks, bringing you various topics on health and wellness and making the public more aware of issues that are not being discussed. We thank you very much for tuning in. Hello. Thank you for joining me today on Let's Achieve Change. I'm Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. Listen, if you want to make some changes, you have tuned in to the right podcast. Now listen, don't forget to hit that notification button so that you can subscribe and you won't miss any future episodes on some changes you might want to make. Hello there. Welcome back to Let's Achieve Change. We're in episode 9 of season 3. And I'm excited today because we have a great guest on today who's coming from the perspective of being a healthcare worker, of having also have had to be a patient care advocate and caregiver for someone in the VA system, as well as someone in the hospital system, as well as an assisted living facility. So I think she's coming to us with a lot of good perspectives. So I want to just give a little bit of intro, talk about, connecting the dots, knowing the who, what's, and hows, and how that makes a difference in your healthcare. We're finding that there is so much lack of accountability in the healthcare system, from the physicians down to the ancillary staff and front offices, from the actual professionals, such as the social workers and the therapists and the nurses, and as well as the CNAs. So everybody's lacking the accountability in a lot of these situations, and this is what needs to change. So I want to emphasize that, yes, patients got to be accountable. We need to know what our checklist should be about, and I'm going to get that done at the end of a little bit of a short checklist for you of things you should do so that you are more effective in your healthcare. But today's episode is also to share a little bit of light and also to make a plea out there to some of those healthcare workers in these different scenarios, and let you be able to become more accountable, just so that we can have a better healthcare system and less people can suffer out there. Okay. So I'm going to bring on Darlene. Thank you. Hi, I'm so excited to have Darlene on today. We're starting in a chapter for the next 3 months on dealing with a lot of the hidden harms in healthcare, as well as in society for various reasons. And Darlene is coming to the table with a lot of good information. She has personally addressed different issues, but I'm going to want her to introduce herself and let her start off a little bit of, whether she worked in healthcare, and then we'll go from there. Darlene, thank you for coming on.
Thank you for having me. Hi, everyone. This is Darlene. I worked in healthcare in a capacity of front office support staff for about, I'll say 11 months. And I got to observe a lot of different things with patients coming into the clinic for appointments and things of that sort. I also was a caregiver for my spouse for 10 plus years.
Wow. Okay.
And had to act as his advocate, his primary point of contact, his healthcare, power of attorney, all of those kind of things.
Okay.
And then I also had a sister that I wasn't a direct caregiver for, but I often was engaged with conversations about her healthcare and her caregiving scenario and that kind of stuff. So,
okay. So with that being said, let's first start off with the healthcare position, because I think you're going to have a lot to add when it comes to the other topics. So let's start with the healthcare position first. And I first want you to speak to the fact, do you feel as if, and it may not have been you personally, it might have been other members that you saw on the team. Do you feel as if the things were carried out as they were indicated to you for plan of care for the most part? Or did you see times when it was not carried out or it was delayed for any reason or another?
The only part on that I could speak to would be the piece of plan of care where patients' appointments and things were not scheduled appropriately within the appropriate amount of time, not necessarily due to the front end staff, but it may be because of the scheduling of hours for the physician's availability. And then how, what I thought was interesting, some doctors, they always allow time in their schedule for those walk-in kind of emergency scenarios. And then others don't. And then at the time when I was working, it was post-COVID. So there was still a lot of hybrid scenarios where doctors were offering virtual appointments, which I thought was something that was good. And in some cases, I wish they had done that more often for those patients that were really having, I say, an emergency situation, but not necessarily an emergency room situation. That they maybe should have, could have, wish they could have made more time to do that kind of situation for the patient.
Very good point. I like that a lot. Okay. So you said sometimes it was a delay in appointments and basically you saying pretty much because the physician wasn't available, basically, right? But did you ever have specific instances? I know people have been bringing this to my attention a lot, that sometimes the front care person just, maybe they got busy and maybe they didn't go back and maybe they didn't ask the question to the physician. Did you see that often a lot, even to follow up on certain things?
Not so much in our office because the way our office was organized, we had 3 front end persons. We had someone that had the responsibility of confirming appointments, someone that was responsible for monitoring referrals to other physicians and doctors, someone that was kind of monitoring the referral approvals and that kind of stuff. So that by the time the patient got to the window, all of that preliminary stuff was taken care of, or the patient was aware of what they needed to have with them or bring in. But there was always those cases where something fell through the crack. But in our office, it didn't seem to be like it was a rampant issue of negligence or just people didn't care. We were fortunate in that respect.
You had a very good office. You had a very good office then. Yeah.
And I think a lot of that comes from the office manager because they set the tone. They set the tone for everybody else. So if they have a patient care first attitude, then everybody under them will, because they know that's the line that they have to toe. And it was not uncommon for us to see executive management come to our office on a quarterly basis just to kind of walk through, hang out, monitor, peek their head and see what we're doing, that kind of stuff. So,
So that was an excellent office. See, we can take some notes from that. Because if that was going on more often, I think we would have a little bit more efficiency in some of these offices, because that's not what we're hearing. That's not what we're hearing a lot. Okay. So basically, other than that, I think pretty much you said it all. Good office manager, enough staffing, and tell me if I'm wrong, I'm trying to summarize, making sure that it's like different line of commands are done in each area of the office. This is taken care of, this is taken care of, this is taken care of. Pretty much. Okay. So good. Kudos.
Now, the flip side, on the patient side, I can give you some other.
Now we're going to go to the other side, okay? Because as a healthcare worker, you did your job, you did well, and you had a good experience. Now, let's talk now from as a patient caregiver for your spouse. Let's talk about some things that you probably experienced that maybe should not have been done or could have been done better. Give us some instances with that.
I'd say probably my first experience that put a bad taste in my mouth was what I felt was lack of continuity or who was in charge. My husband was a veteran, so we were dealing with the VA and dealing with VA providers plus, external providers. Who's got the reins? And then when you get to the hospitals, if there's a hospital stay involved, then there's a whole nother person who's in the reins. It didn't seem to be a clear line of communication between the 3 parties as to who was calling the shots. And I didn't find out until later down the road that there was this position called a hospitalist, somebody that you may have never seen before. You might only see that one time where you're in the stay, and that's it.
Wow.
So there's all these bodies. Gone are the days where, I guess in my mind, your primary care doctor was the one that was leading the charge for your care.
Right. Right.
That's not the case anymore.
Mm-hmm.
We have to hold the primary care doctors' feet to the fire in addition to all the other ancillary providers' feet to the fire.
And not to interrupt you, but you had to learn that. You know?
I had to learn that, unfortunately.
And in that process of learning that, didn't he suffer? Didn't he suffer some harm?
He did. And, the other thing is what I found was depending on where the care was being provided, it was like night and day.
Okay. Yeah.
Because he was hospitalized in two types of facilities. Well, I'll say three. One, which was, I'll call it a prestigious one. And the care and the channels and the levels of care were very clearly defined. However, what I did early on with his early diagnosis of what he had going on and knowing how severe his situation was, I carried a notebook with me.
Wow. Okay.
Inside my notebook, I had pre-printed labels with every doctor's name, phone number, fax, email, who their nurse was, all that. And I had sticky labels. And so whenever I went to a doctor, and I had a sheet with all of his medications.
Wow.
Dosages, all that kind of stuff, when they expired and all that. So when they asked me that same question, they ask you over and over again, rather than me getting frustrated and repeating it, I just take their sheet out here. This is for you. Put it in your file.
Yeah.
Got it.
Yeah.
That, I think, told them that, okay, this person is watching. She knows what's going on.
Exactly.
So the more organized you are when you're advocating for yourself or for someone else, the better it's going to be for you.
Good point. I like that.
Yeah. So take notes. When I was in with the doctors, I was taking notes. I take pictures of whatever they gave me and just make sure that we were on the same page, because that's critical. Otherwise, you or your loved one could suffer, because human beings are human beings. So they're going to make mistakes.
Yeah. Oh, boy. I'm glad you learned it, but I tell you, I know you went through a lot of trial and error with that. And I know that it was a lot of stress on you, because there's no way in the world you could go through all those scenarios and that not be stressful. No way in the world. Yeah. And basically, from your perspective, that the person who is giving the care, who is a patient advocate, has to be more organized, has to be more, I guess, more aggressive in their approach. Okay. For lack of a better word. But let's talk about that. That's what we need to do if we're the patient advocate. But what needs to be done as far as the hospital staff, as far as the physicians, as far as the VA system? What needs to be done on their part? Because, it should all fall on us, right? As caregivers, right? So we need to bring up these topics. What needs to be done? They need to hear this. What needs to be done on their part? What could have been done better with those doctors? What could have been done better with those other staff members? What could have been done with the VA system?
VA is a monster in and of itself, and not all doctors are in this scenario, but I think the physicians need to remember that they are there to serve their patients, to take care of their patients. And sometimes they need to slow down. Now, granted, there are patients that are just take advantage of that and they overstep their time, and that makes it bad for the next person in line. But even in that case, the doctor needs to be communicative with the patient on the patient's level. Don't talk out here in, textbook land or whatever. You need to talk to this person to person, human to human, right? And make sure that the communication lines are open, because if they're not, they're only going to hear what they can understand. Exactly. And then the rest is going to fall off the table and they're going to walk out of there frustrated and disappointed. I think the doctors need to follow up. If they're not in charge of the decision-making on a particular scenario and they're referring you to someone else, then I think the doctors need to follow up with you. Did you hear from Dr. X, Y, and Z?
Good point.
That kind of stuff. Just at least making sure that the next person picked up the baton before they turn their back and move on to the next, because it seems like, the patient becomes a number rather than, a patient.
Yeah. So. And they can, as far as I'm concerned, they can appoint people to do that for them.
Absolutely.
You can have a team to do that for you if you thought enough to do that. You know what I'm saying? So,
And it's about how they organize their staff and to do these. Now, some clinics have it set up that way. So someone is following up on those pieces. And I know they can't catch everything, but a little bit helps. Yeah. And when you see that care or that attention to detail, even if the patient's scenario is not the best as far as their health and stuff goes, their morale in addressing it or facing it,
Yeah.
I think it's so much better because I've seen that happen.
Yeah. And you know what? Patients are going to be more compliant.
Yeah.
They're going to be more compliant if they feel that oh, you know what? That doctor's office is calling me back. They're concerned. They're going to be more compliant. I can think of so many times when I have asked a patient, have you heard back from the physician about this? Or, no, nobody's called. Nobody's calling me. No, you know.
Now, something I noticed recently, there's a new healthcare clinic that's opening up in my area for seniors. And they advertise kind of that they're an advocacy team for the patient overall health, this, that, and the other. And they've got patients giving testimonies that, they not only care about how I'm doing health-wise, but they want to make sure that I'm, living the best life I can. And they're trying to work through my situation. They're explaining things. So somebody's hearing the message. Now, whether this clinic does it or not, I don't know, but they know the situation exists.
And that's what we want to do. We want to keep ringing this bell. We want to keep ringing this bell. It's got to make a difference. We got to be hearing. People got to be hearing it because there's too many stories like this over and over again.
Unfortunately, they want to attach a dollar figure to anything they do.
Yeah.
That's the unfortunate side.
That's unfortunate. Because if somebody can afford that, then they fall through the cracks.
Exactly.
Yeah.
Exactly.
Yeah. So talk to me. Do you know anything about the healthcare proxy? Because healthcare proxy, my understanding is it's like a legal document for a power of attorney kind of thing, right? Is that what it is? Talk to me about that.
If I'm thinking that, okay, so we called it the healthcare power of attorney here. And basically what that does within our facility here, and I think within my state, you are given the permission to make decisions or speak on the behalf of the patient when it comes to medical treatments, acceptance or denial. You also have the opportunity to make those decisions, those end-of-life decisions on behalf of that person. And now, as long as the patient is of sound mind, at any point in time, they can revoke that.
Exactly. Yeah.
So it's really to be used when they are not of sound mind.
Right.
Yeah. So if they've got the ability to make their decision, I would hope that their caregiver is going to defer to them first to see what they want and then to make sure that what they want is enforced.
Yeah.
And when they can't speak for themselves, they will still do what they last understood that person wanted.
Right. So to sum up, my understanding is we need to make sure people are knowing how to act as patient advocates. And then they need to also have the legal document in place. And I think that should be something we all are doing. I know personally, I have to still get that in place for myself and I haven't done it yet. But we need to have someone who can act in that capacity if something happens to us. Because I'm hearing too many stories too, that people have been in tragic accidents. Something has happened. There's no power attorneys assigned. Family member comes in, want to help make a decision, and they cannot.
Right.
Cannot act in any type of benefit. In that benefit, they can't do nothing because they're not down. They're not down.
The other thing on that note, which I think would probably be beneficial, is that if you can have a secondary backup so that if that primary healthcare POA is too distraught, too emotional, just can't make that decision, someone else that knows what the patient would have wanted to kind of step in and maybe not to override the other one, but at least put on paper that I too also know that Betty Jones wanted X, Y, and Z to happen. So that if it's on paper and person number one just doesn't want to do it, but they see that person two knows that this is what she wanted, that person can come in and enforce the patient's.
So is that also legal? Because
I don't know that. I don't know.
I don't know about that. I have to check on that because I haven't heard about a second person in command.
But maybe that's something that families may want to have a discussion about, especially if something like we all need to be taking care of our final wishes.
Yes.
So that needs to be documented somewhere in the event that so-and-so is not able to speak on my behalf for whatever reason. This is the person I want to do X, Y, and Z.
Wow.
So it's just very important because, and especially in the case where you have small children.
Yeah.
So we definitely need to be thinking beyond your present state.
Exactly. So can you speak of anything in particular that either from the situation of your sister or that you heard, because she was in also, not just in the hospital, but she was in a long-term facility as well. So can you speak of anything that maybe she went through some type of hidden harms, or, and she suffered silently because there was lack of, it could have even been like not enough staff, because sometimes lack of staff, that type of thing. So can you speak to any of that?
Well, and that's the other thing, depending on what kind of insurance the individual has.
Here we go again, insurance.
It's going to determine what kind of care you get.
Poor people who don't have good insurance. Huh?
Exactly.
I think we have so many people in this country who's in that situation, all the countries too. But go ahead. I'm not going to.
But fortunately, in my sister's case, she did have fairly somewhat decent insurance to cover a lot of her medical costs. And then some of her other funds and stuff that she had, procured over her years of working and stuff were able to help out with other costs. But what my family ended up having to do was, because the care facility, they did not have the ability to provide someone to give her that one-on-one care, even if it was just for a couple of hours a day that she was getting when she was being taken care of at home. Because things were falling through the track. Was she getting dressed and washed and cleaned, on a regular basis? Were they using the proper items to get her dressed and to get her washed and to get her clean? Were they checking on her when she was going to bed to make sure she was dry and those kind of things? Unfortunately, in a lot of these nursing facilities, you will have some young, unexperienced caregivers that are just there to make the money. I'm not knocking them wanting a paycheck, but there needs to be more patient-centered empathy encouraged so that they understand this is another human being's life.
Exactly.
And
and not to interrupt you. Also, that the staff, there's no camera here, there's no state coming in, and there's no family member watching. But it doesn't matter. Still care enough to give my all in this situation. That needs to really be impressed.
Yep. And also the family members, they need to know what their options are should stuff fall through the cracks. So like if you got a caregiver that's being paid for through Medicare, and things just aren't happening, they're showing up late, they're not doing what they're supposed to do. They come in and they sit on their phone all the time, and you make complaint after complaint after complaint to the manager. There's a position, I think it's the correct title, an ombudsman. Basically, and each state has one.
Ombudsman.
So, identify who that is if you're putting your loved one into some kind of a care facility, just to ensure that their care is up to speed. Most hospitals, and I think Medicare across the board, has a form that you have to sign when you're being admitted to a facility, because Medicare is paying for it. It's your patient's rights and responsibilities that you can, that you have someone you can talk to. You can complain to them. There is a process. Don't just sign it and stick it in a drawer. You do have some outs in that perspective. So know what your rights are. Speak up, pop in, call and check in, and it doesn't have to be a heated type of thing. Bring us some cookies every once in a while. Bring a bouquet of flowers and say, hey, I really appreciate you. Sugar will take you a lot further than vinegar will. And let them know, hey, I appreciate what you did taking care of my parent or my sister or my brother or whatever. Thank you for caring about them. Whatever means necessary on the positive side to encourage them to step up and do it.
That's good. I like that. I like that. I like that. I like the positive side, because we don't think about that sometimes of how that would make a difference, Because
we don't know when those individuals go home, we don't know what they're facing, what they're dealing with. And if it means for me to come to work as my escape, and somebody comes and tells me something that makes me smile or have a good day and be nice to their loved one, then I'm going to do it. Because that's getting me over a hump too. And we got to take better care of each other across the board. So
And also too, in their defense too, I know that almost everywhere I've been, that they're understaffed. They're understaffed. And that's another thing we need to speak about. We need to be speaking about people who own these facilities. You need to be really thinking about that. When you're owning these facilities, you open up these facilities with that in mind. You're going to have individuals who are going to take care of these people. And you should always think about that. How many people can take care of one? Like one person can only take care of in a shift, maybe five.
Yeah.
Maybe 5 in an 8-hour shift. Maybe not 10.
Yep.
Okay. And that's something I think needs to be said a lot too. I got some people going to speak more about that who's in those type of facilities. But so
I did want to say one other thing. I have a friend whose daughter did have an adult care program that she was running. She was a registered nurse and she had her own business doing that. And one of the challenges she had, it wasn't finding patients. It was finding people that were willing to work, show up to work and be good.
Yeah. Yeah.
So I think the education platform where these people get these CNAs and all of this other kind of stuff, that needs to be readdressed.
Yes.
Because, just like your license is important to you, they need to be made to understand that your license or certification that you have is tied to you. You could be liable for X, Y, and Z for not doing stuff. It's just as important for you to do it as it is for a doctor or a nurse.
Yeah, I don't think that's definitely not in place. You know what I'm saying? That's not in place. And that licensure, I think they get it too quickly. They don't have enough education background behind those licenses. That I know that for a fact. They don't have enough time learning certain skills and certain things they need to learn to do that job well. You know what I'm saying? So I really feel that's something else that needs to be spoken about more. So I think we pretty much cover a whole lot of things here. We summed up about some of the recommendations if you're going to have someone in a nursing facility. We spoke about what can happen when we couldn't take a whole lot of time with the VA system. We didn't do a whole lot with that. But that's a big system that needs to be improved upon too. Yeah. Unfortunately, so we got cuts happening right now that we don't want to get into a political thing right now. But we know that there's a lot of cuts been happening in the healthcare system. But the VA is a system that, can you just speak on that for a few minutes before we end? Because we're going to end a little bit. How difficult was it for you to get what you need to get from a VA?
Well, again, my end with the VA and getting what I needed was through my social worker.
Okay.
When I found out who my social worker was and who the doctor's nurse was, that's who I communicated with, and that's how I got things done.
You have to find out who the social worker was.
Who the social worker is. She works as hard. The only thing she doesn't do is prescribe medication. She was able to get me the things, the supplies, the tools, the stuff that I needed when I needed it.
Okay,
this nurse helped me get messages to the doctor, whether he read my messages or not, but what I needed, he wrote the prescription for it.
Okay.
So that is very important. The other thing is VAs differ from state to state. Okay. You can talk to somebody who's a VA patient, let's say in Georgia, and they got nothing but high praises. And you might come to North Carolina and they'd be like, oh my gosh, it was horrible. Or it was from county to county. So it all depends on who's running it. I'm hoping that at some point they'll all be kind of on the same page, but who knows? Who knows? All you can do is pray about it.
but that is helpful information about the social worker, getting into contact with the social worker. But on that note, and I had somebody who I spoke to yesterday, as a matter of fact, and I'm glad you had a good experience with the VA with the social worker. But I remember this person telling me this just yesterday. She said, well, I talked to the social worker and I thought she took care of her, but she didn't. So I said to her, that does not necessarily mean that's going to be taken care of. So, and I told her, you need to follow up behind the scenes.
Absolutely. And I had to follow up with mine, but it got done. It wasn't like on my first try. She took care of it. I requested it. Then I would send her another note. Did you get my message? Then I'd send her a voicemail. I sent you a message. Did you get it? And she would call me back. It might take 4 times, but by the 4th time, she knew what I wanted. She wanted me to get off her back, and she took care of it.
Yeah. And so with that being said, because we're going to end about 2 minutes, still, we have to still hold those people more accountable.
Absolutely.
Social workers, they need to be better. And once again, they're probably low staff too, but they need to follow up on calls more frequently. You see? So there's still so many different things because if the person does not know. Look at when I told that person that yesterday, she goes, oh, well, I didn't know I had to follow. Yes, you got to follow. She didn't think about that. She told what she told her. That was going to be it.
Yeah.
So even that being said, that person needs to be more accountable. You're holding someone's life in your hands and you need to follow up. You know what I mean? So, but you are giving us some good information. You've had some good experiences, I can tell, which I'm grateful. But we know a lot of people out there who are not. So we want to make sure they're getting some of this good advice. Okay.
My biggest thing is we have to be more aware of what's going on. We got to look at is in these political offices. I know you don't want to get politics in here, but those are the ones that are making these decisions and pulling the strings. And we got to be better advocates for ourselves as citizens if we want the things we want to have happen.
Yeah. Well, I'm so grateful to you. I know you went through a whole lot to learn what you've learned, but I think that's why you learn what you learn. God wanted you to be able to teach some other people and help some other people. So I'm grateful for that. Okay. Anything else you want to say before we close out? You were awesome. I'm so grateful to you. Anything else?
Just take care of yourselves.
Yeah. Okay, Darlene. Thank you for coming on.
You.
We'll see you soon. Okay.
Bye-bye.
Bye-bye. Thanks again to Darlene for all her great information. Oh my gosh, she was awesome. I'm just going to just close out to do a little bit of a summary. I think she said a lot, so I don't want to be repetitive, but just making sure that, we know who the social worker is. We're in the VA system. We know about the hospitalists in the hospital. We are very aware of the ombudsman, that process, that making a complaint if we needed to, making sure that we're getting better at getting adequate staffing and training of the CNAs because they play such a vital role in healthcare. And also making sure that chain of command is followed through from the office manager all the way down to the staff workers. Okay. I'm going to make a special announcement because Let's Achieve Change will be making some changes. We will be going on sabbatical for the next month, but I don't want to lose my listeners. So I want you to listen up. This is very, very important. So I'm excited about this because Let's Achieve Change will be ramping up to do a whole new educational platform to bring you more educational information and more awareness out there about different topics that are so important to chronic pain as well as to disabilities and all types of injuries and et cetera. Okay. So what I need you to do, I need you to go on to PamelaGrove.com. That's my website, and leave your email, because what you will be able to do if you do that, you'll be able to receive the free lead magnets will be given out. And that'll be like little tidbits of educational information, as well as we'll be doing a monthly newsletter. And we cannot get that to you unless we have your email. So go on to the website for that. Also, stay tuned for the we'll be doing like twice a week of short videos on YouTube's and in the social media platforms. So stay tuned for that. So if we have your email, we can let you know of all these updates in the platform and what we'll be doing to offer you some more educational insight. And once again, thanks so much for supporting us and for staying in tune. And we will talk to you soon. Bye-bye. Thank you for tuning in today at Let's Achieve Change. Don't forget to like, share, and subscribe. You will find out more about Metanoia Education and Wellness Center on our website at changeachieve.com. We welcome your questions and your feedback. Please feel free to fill out the form on the website and we will contact you directly. I pray that you prosper and be in good health, even as your soul prospers. Remember, it's all about the change. Thank you.